Good morning and welcome to Reopening Connecticut Arts Venues Science-Based Safety. I'm Eric Dillner, CEO of the Shoreline Arts Alliance and the chair of this task force. The mission of our task force is to offer you the opportunity to reopen your arts venue from a public health perspective, provide a listening and sharing platform, and to help consumer confidence through science. To quote my colleague, live entertainment and the arts will never go away. It's what makes us human to create and experience the joys that it brings. When times are tough, people seek out the arts and crave the feeling of unity. We need the healing power of the arts more than ever now, and we'll be ready to provide those in-person experiences once again when the time is right. So today, let's make sure we work together to ensure we set the course to offer that feeling of unity once again. Thank you so much for joining us today. Your leadership is vital in securing a healthy future for arts and culture. We encourage everyone to attend each of our webinars and follow Shoreline Arts Alliance's YouTube channel and Facebook for past webinars, important information, and video vignettes of our recent site visits. During our discussion today, let's use the Q&A in Zoom for asking your questions and reserve the chat for resource sharing, telling about your successes and moments of clarity. Sten Fairmoon, the Dean of Public Health, and his team are extraordinarily generous with their time, and we ask you respect their time by sending your questions and needs through the task force members. We're thrilled to get all those questions. They're so helpful in informing us what you need and what we should be doing next as a task force. Let's meet the folks who are here to help us reopen Connecticut arts venues and keep us safe. I'm pleased to introduce to you once again my co-chair, Sten Fairmoon. Sten is the Dean of Yale School of Public Health and holds the Anna M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. As an infectious disease epidemiologist, Sten's research pivoted quickly to focus on the COVID-19 emergency. Sten and his wife are deeply fond of Connecticut's cultural arts, and he's pleased to offer his advice and counsel to arts and cultural organizations. Today, we also have Sten's colleague, Marie Bro. Marie is a medical anthropologist and a public health researcher in the Department of Social and Behavioral Sciences at the Yale School of Public Health. She uses mixed qualitative and quantitative and participatory methods to explore individuals' and communities' health needs and concerns for the development, adaptation, implementation, and evaluation of contextually appropriate interventions to improve health and wellness. During the pandemic, Marie has begun working on issues related to health communication, contact tracing, and the expansion of the public health workforce. She has worked in domestic and international settings with youth and adults. So today we will focus on creating a positive environment for a positive experience with science as our guide. Our public health team will offer suggestions on messaging so that the general public will feel more comfortable returning to the arts. Make recommendations for venues to instill confidence in their artists and teachers so they feel safe returning to work, and suggest tools which may be used to assess consumer confidence. So Sten, again, thank you and welcome. I ask you first, how do we prepare our venues so that we instill confidence in our general public, the artists, students, volunteers, and our staff? Sten?
Thanks, Eric. Thanks for everything the task force is doing for the arts in the state, and we're just happy to be a small part. We have visited a number of venues, and at the risk of sounding like a broken record, so much can be done so safely. Let me give you an example. So the Yale School of Public Health will be substantially online in the upcoming term. However, we will have some face-to-face courses. Now, how are we going to do that? We're going to apply fundamental principles of disease control when it comes to respiratory viral spread. We're going to be mandating mask use on the part of the professor and the students. We're going to be enforcing physical distancing. You've all heard the 6-foot guideline, and what you may not know is that that 6-foot guideline is actually quite substantially based on evidence from airplane outbreaks, from restaurant outbreaks, from venue-based outbreaks, you see this very strong association with 6-foot proximity, with far less risk beyond that sort of distance. We have a third theme, which is the hand and face and surface hygiene theme, careful hand washing and cleansing of surfaces. And then a fourth theme of small groups. The smaller the group, the more cohorted the group, the less networking is being done and the less transmission to a wider audience happens. And then finally, the concept of air quality. Now, one way you can do air quality, and I was pleased that my colleague, Professor Crystal Pollitt, is on the phone today in case any questions come up on air quality. That'll probably be the major theme of our next webinar. But she has been advising groups all over the state on how to maximize the purity of indoor air, and also how to consider pivoting certain activities towards the outdoors. We were at Florence Griswold Museum a few weeks back, and they've moved their entire ticketing operation into an outdoor barn. And you'll get your tickets online, but if you have any concerns or questions or other issues, you can then approach the box office, but it will be out of doors. Very clever, I thought. So again, these 5 principles: masks, physical distancing, hand and other hygiene, small groups, and air quality. Pivot to the outdoors if you can, improve the air quality indoors as you can. So those are sort of some fundamentals. And then to help our clients, we need proper signage. We need to be able to, if we want one-way flow of traffic, we have to let them know. If we want 6-foot distancing, we need some cues on the ground to let them know. We need to have arrows pointing to the hand sanitizer. We need some special consideration for our shared spaces, such as our bathrooms, and the notion of strategic use of plexiglass to create separations where 6-foot distancing is not feasible, and on and on and on. Many, many different themes, but not wanting to take any more time. That's my sort of icebreaker. Many of you have heard it before, and I hope that just the reinforcement will be helpful. And I'll leave it at that, Eric, unless you wanted me to comment further.
No, that's perfect, Sten. Thank you so much. We all got to wrap our heads around it as much as we can. So Marie, let's move over to you. Do all of these site preparations provide true comfort for our patrons? Let's get inside of their minds for a minute. Do we as visitors process signage and about wearing masks and keeping your distance in a favorable way? Can we process all that in a good way?
Yeah, thank you for inviting me to join this morning. It's nice to meet you all and hear the questions. I think the short and easy answer is that most people are really concerned about this and do want some guidance. I think that can, having the visual cues, the signage is really helpful for most people. I mean, there's always going to be kind of that small minority group that is not really going to like or believe or trust anything we might want to put in place or put out there. But I think in general, people are looking for guidance and for reminders because of all of the uncertainty. So anytime you can provide those visual reminders, signage, some people really like to see kind of the specific written out protocol. Some people like pictures, so figuring out the appropriate mix for your audience, your patrons is really important. But I think on kind of the flip side is you don't want to throw too much at people. I think there are, I think there's some cases in which, you can kind of see behavioral fatigue a little bit. And, if you've got too much going on, too many signs, too many pictures, bombarding people with too much, then it can at a certain point kind of become a little bit of white noise. And so really just trying to balance that. And, for any organization that has a marketing or communication specialist, they're really fantastic at thinking through kind of what that appropriate balance is.
Excellent, great, thank you so much, Marie. I'm glad to hear that all the work that we're doing, all of us collectively, in looking at our spaces is going to have great impact. And I really want to echo what you said. Clarity and not giving us too much information as a visitor is so important. So thank you for joining us also again today, Marie. Judith McElhern from 5 Point Center for the Visual Arts in Torrington would like to ask you a question. Judith? All right, well, I have her question here, so I'm gonna go ahead and ask it for her. When should we begin sharing our protocols with our potential visitors? And how should we go ahead and do so?
Sure. I think the sooner the better. I think, everybody is kind of going a little bit stir crazy. It's the summer, we're not taking our normal vacation. So people are looking for alternatives, things that they can get out and do. And so if you have a website, put on your website what you're doing to ensure that you're following the proper protocols, and you're going to really work to ensure people's safety as much as possible. So I think really kind of, if you think about like the whole process, as somebody is planning a visit, as they're looking at a venue that they might be interested in going to, providing them that information on your website or on social media, or if you're promoting a concert or some other event, let people know what you're doing in that promotional material. I think, when people buy tickets, again, kind of a reminder of what you're doing and what they should know before they get to the venue and when they get to the venue. And, just kind of trying to be as open and consistent as possible throughout that process, from when somebody's first starting to plan their visit to when they buy tickets to when they get there. I think it also really helps to show that you're an institution or an organization that's guided by evidence and experts. I think that also is really helpful if people know that, yes, we're working with public health researchers, epidemiologists. I think that always makes people feel a little bit better and safer. And, just making it very clear what your organization or venue is going to do to keep people safe, and how you'll enforce those safe practices. And again, just starting with the marketing and kind of following through that into the performance, into the venue. And again, like I said, if you have a communications or marketing person, they can be your best support in developing that clear messaging and guidance.
Excellent, great. Judith, are we able to get you back online here? Are you in? Would you like to follow up with anything else?
Do you suggest that we share photos and videos of what we're doing in our lobbies and other spaces, gallery seating, auditorium seating, and the changes we've made? Is that good to put up on our website and so forth with photos and videos?
Yeah, I think absolutely. It's a little bit hard for me, I think, sometimes to think about, what is it going to look like to be making sure that I'm 6 feet apart from somebody at a venue. And so anytime you can provide people with pictures or video of kind of what their experience is going to be like under these new safety precautions, that's just another way that you can make people feel more comfortable and they know what's going to come next.
That's really helpful. Thank you.
Great. What are some of other messaging approaches that could be used by organizations to show that they're attentive and responsive to consumer concerns?
Sure. So I think that, it's really important to kind of generate good publicity and kind of get messaging out there that you're doing what you should be doing, you're following the precautions, you're guided by experts and scientific evidence. one thing that you could do for some venues, some organizations, it could be really helpful to have a pilot or trial performance or event where you have you invite a select number of people, maybe your members and maybe some people from the media. And really this kind of trial run can do two things. First, it lets you see what works and isn't going to work in kind of a more controlled, easier to handle setting, kind of like a dress rehearsal, so to speak. And then second, once people see that this can be safely done and they have a good experience, they'll feel better about coming back to your venue. And they'll tell their friends and their family about the good experience that they had. So I think that, that trial run can be really, really helpful way to show what you're doing, kind of promote what you're doing. And then I think the flip side, which is probably very obvious to everybody, is you really want to avoid any bad publicity. I think we've all seen pictures from the school in Georgia with the students flooding the hallway, not wearing masks. The pictures from the event in the Hamptons, the concert that kind of got out of hand a little bit. And, it really only takes like one or two of those pictures going viral for people to lose a lot of trust. And be like, I am definitely going to stay away from that place. They don't know what they're doing. They don't have good control over their events. So, think about both of those things as you're trying to plan to welcome people back.
What a great suggestion. Thank you so much. Yeah, as we venture into a restaurant and we see somebody not quite doing what we think they should, sometimes that makes us uneasy. So we obviously in the arts industry and culture industry need to make sure that we're doing a good job of not projecting the wrong thing, really projecting all the good things. So thank you so much for bringing that to our attention. So let's just think now that our patrons are ready to come back to our venues. How do we ensure that our staff feel safe and confident to return to work? Sten, perhaps you might want to jump into there.
Well, you can imagine as the dean of a school here at Yale, I have the same challenge. Our staff want to watch out for their health of their children, their health of their parents and elderly relatives. They themselves may be older or having a risk factor for COVID complications, pre-existing condition, or they may have a loved one with such a thing. And you can be anxious about this if you're a completely healthy 28-year-old living at home, living on your own, and you don't even have connections. So it's perfectly reasonable to be nervous about a novel virus for which our treatments are suboptimal and we don't have a vaccine. So that's rational. First thing you do is don't start thinking that your staff are irrational for having fear of this virus. It's perfectly rational. The flip side of it is there's a lot of excess fear that is not evidence-based, that is not based on the realities. So, for example, risk for children. Of the deaths from COVID in the United States, less than 1% have been in persons under the age of 35. But 45% of the population in the United States is under the age of 35. And risk in children and in young adults is far less than in risk in older persons. When you get beyond the age of 35, there's lower risk till you're about 45, a little higher till you're about 55. And when you're 65, it takes a big jump. So persons my age are unambiguously the highest risk for COVID. And guess what? A lot of our volunteers are persons my age. People who are retired, people who have a little more time on their hands, people who've developed a passion and an expertise in art, in drama, in dance, in music. And so they're volunteering as docents. They're volunteering as ushers. They would like nothing better than to help people to their seats and get to see the concert. We do have challenges with our volunteer pool because many of them are in a risk category for COVID complications. A second group is our own staff, who may or may not be at risk. But we have persons in the arts who may be immunosuppressed. Maybe they have HIV co-infection, or they've been battling cancer, or they have an immunosuppressive autoimmune disease like rheumatoid arthritis, whatever it might be. They may have a substantial weight problem. So there are a whole raft of people who are in, if you will, special categories of risk. And number one, we can migrate some of their work to home. There may very well be employees in our network who can do most of their work from home and don't have to put themselves in harm's way. We can mitigate risk. For example, box office work can be migrated online, and we can enhance safety in box offices with plexiglass screening and this sort of thing. A third strategy is the distant docent. I just cooked up that name. I hope you like it. I'll give it away for free. I won't trademark it. The distant docent. So the distant docent is the person who knows that you're at Station 7. And they have photographs of Station 7. They don't know exactly what you're looking at. And they have their knowledge base about those items that you're looking at. Could be a piece of art, could be a historic building, could be someone's former home and there's a history background. And one could craft a sort of a narrative around Station 7. And they're not even there. The docent is talking to them on the telephone or through the internet. One could even tape these things. But if you want the live action, which I think many people value because you can actually ask questions on the spot, then the docent could be at home. The docent could even be accompanying the visitors with somebody's WhatsApp, and somebody's volunteering to take the WhatsApp. Does anybody use the WhatsApp? 3 hands go up. Well, would you mind calling so-and-so? And as you scan the WhatsApp, the person will share this with you. So clever out of the box ways of doing business. One-way flow of traffic, minimizing proximity, all the things that I mentioned earlier. So a whole raft of staff can be kept safe through the classic measures. When I teach in the fall, I'll be teaching face-to-face. And I've taken a class of 35 students and I've migrated to a room that seats 180. And some of my students will prefer to be online, and I'm accommodating them. And so I will have a decompressed classroom. Well, you can do a tour of a museum in a decompressed way. You can fill an auditorium in a decompressed way. So there are all sorts of strategies that we can use to genuinely keep our staff safe, educate them about exactly what we're doing to keep them safe, keep higher risk staff away from the general public and doing their work either through the distant docent or through working from home, and on and on and on. I'm sure somebody will find an exception saying, well, I have this one staff and they have to be doing this and they have to be doing that. So challenge me. If you've got a particular dilemma for a particular staff member, let's think it through together. If you've been thinking about it and you're stumped. But ultimately, I think we can keep our staff safe and we can educate them as to how we're keeping them safe. And that's where Marie's agenda that she's been talking about, it's not just keeping people safe, it's telling them how you're keeping them safe. It's letting them know that they're being kept safe. That is vital. You can do something for somebody, they don't know that you're benefiting them, and then how can they have confidence in you? You haven't told them.
Absolutely. Thank you, Sten. That's really puts us on the right frame of mind here. I hesitate to bring this up at this moment, but we've got a couple of questions that just came in that I'm gonna share with you, Sten. And one is something we've discussed a little bit before. and we may need Marie's input here as well, but we've talked about liability waivers a little bit, and how we might want to ask our volunteers to sign something. Do you recommend that, first of all? And then secondly, does that put them at ease, that or will that, or how do we do so that it puts it at ease and not puts them on the defense?
No one has ever signed a liability waiver and it has put them at ease. It's never happened in the history of humankind.
Right.
So I don't think that signing a waiver where you say, I am taking the responsibility on myself for coming into work, and it's not going to be your fault if something bad happens to me. That really doesn't reassure anybody. But let's think about what the arts are up against in the state of Connecticut. I mean, we have some of you on this phone call who are not sure that you're going to keep your doors open a year from today, maybe even 3 months from today. So there are fears of the economic consequences of these shutdowns and the need to restore income, to keep our dream alive of whatever we're doing in the arts and museums of the state. So how we reopen and we mitigate the economic damage, one of them might be to limit our liability for lawsuits. And if one takes extensive precautions, then the signing liability acknowledges there has to be some language. This is what we will do for you. We know this can't absolutely protect you. You will not hold us accountable if you contract COVID. Now, a lawyer would have to weigh in as to the legal value of that sort of thing, because there is this sense that you can't sign your rights away. but it may at least create a bit of a contract between you and your staff member or your volunteer, that at least there's a moral agreement that you're not going to hold me accountable for something I have no control over. It's almost like somebody stumbles and hurts themselves, but it was just on the floor. There was no hazard, and there is a sense that that was an unfortunate accident, but it wasn't the fault of the museum. So an attorney would have to answer your question, and perhaps even a specialist in personal injury defense attorney, because I'm not such a person. But I do think that if one had some signature, it would be almost like an informal contract, and I do not know what the legal value of that would be. The flip side of it is, if you choose, you have insurance, and your insurance company is thinking a lot about COVID and consulting with the insurance company to think this through with them might make sense. And at the end of the day, you might be covered. It may be that your insurance already covers untoward events to staff, volunteers, and visitors, in which case it's probably something you don't have to worry about.
Well, tough question to answer. Thank you so much for doing so for us. We're going to have to think about many of those things along the line. But so back to the psyche of our audience and folks. Judy Dworin has a question for Marie.
Yes, Marie, what are some of the ways that organizations and venues can help performers and teachers feel comfortable and safe and confident in returning to the workplace?
Sure. Thank you for the question. I think that, in a lot of ways, it's similar to instilling confidence in your patrons and your consumers. I think, it goes back to if the messaging is clear, if you're doing enough to educate people about what you're doing and why you're doing it, and people have positive experiences, then they're always going to feel better. And I think another thing kind of along the lines of consistent messaging, that's something I've said a few times, but I think frustration that some people are having is that there's a lot that we don't know about COVID. And so what we knew 6 months ago is different than what we know and what we're promoting today. And what we know 6 months from now will probably be different still. And so I think it just really goes back to kind of educating people and saying, this is why we're recommending mask wearing. I know previously, like, there was some discussion about the the utility of wearing a mask, but now we know, because we have more evidence and more data, this is why you need to wear a mask. And so again, just being very clear with your staff, with your performers, with your teachers, about what you're doing and why you're doing it, is really critical. Another thing I'd say is that I think it's really important to elicit input from your performers, from your teachers. It shouldn't be kind of a one-way, top-down dictatorship. I'm a big believer in participatory management and governance. And so, getting their input on what they think will work or not work is really important. And that doesn't mean that, you have to take everybody's suggestion or everybody's ideas, but I think that, if you make the effort to see what they think they are going to need to be safe and perform well, then that's always a much better way to do it. And again, just having kind of those clear policies. What happens if somebody has symptoms? Are they going to be sent home? What happens if there's an outbreak? And again, these backup plans can change as we learn more, and they're going to probably be a little bit different for every organization. But showing that you've put a little bit of time into thinking through those questions, I think will be really helpful for your employees, for your staff, for your volunteers. And also thinking about who your main audience is. Are you a group that mostly works with children? Are you a group that mostly works with older adults? Is there a mix? Teachers, performers might need a little bit more protection, a little bit more guidance if working with little kids. Little kids don't always understand the meaning of 6 feet of distance, or washing their hands for long enough. So just really kind of thinking through the specific and unique needs of your teachers, of your performers, and providing workarounds, providing personal protective equipment if that's appropriate. But yeah, really, talking to them, seeing what their needs are, and figuring out the best way to kind of address those.
Okay, thank you.
Yeah, thank you so much. That's great. John Carl Casa from Connecticut Alliance would like to ask you a question about artists and teachers.
Thank you so much for the answers you've given. But what are some of the strategies we might use to help individual artists, teachers, and staff members gain confidence in returning to work?
So I think one thing that Dr. Vermund already kind of touched on is, personal risk assessment. Everybody's own personal needs and personal assessment of risk is going to be a little bit different, and kind of supporting people, pointing them to reputable information to really help them assess what their personal risk might be, encouraging them to consult with their physician, with their family members, about, what health needs or concerns they have, or people in their family or they're living with have, and really just kind of supporting them to make the decision that's right for them. and try to find out what people are specifically concerned about ahead of time, ahead of coming back, and try to, again, work with them to mitigate those concerns as much as possible. I think that you can learn a lot just by asking people, what specifically are you concerned about, and what could we do to make you feel better?
Communication is key, isn't it, Marie? I think you've shared that with me quite a bit lately. That's great. Judy Dworin, I think you have a question that's come through you'd like to share.
Yes, on behalf of a dance instructor, is concerned about returning to the dance studio and wondering what should she be asking the owner of that studio to provide in order to really feel safe.
Sten, do you want to field that one?
I would like to, and I'm also going to prepare my colleague, Crystal Pollitt. So a dance studio can be roomy or can be crowded. You can put very few people in a roomy space or very many people in a crowded space, and you can imagine those are two completely different scenarios. One can have choreography which keeps people apart, or one can have choreography that Pilabolus-like wraps everybody around everybody else. So which one is more intelligent in a COVID era? Before people accuse me of inhibiting their artistic freedom, keep in mind that this year is different from a lot of other years. This year is a year where we're confronting the virus, trying to keep it to a bare minimum and go back to normal life, as our scientists are discovering new therapies and discovering new vaccines. So we're hoping that 2021, 2022 is going to usher in the era of therapy and vaccines for coronavirus, making it more like the flu every year rather than this paralyzing pandemic as it is now. So these drugs are in the pipeline, and some of them are likely to work better than the ones we have now. And the vaccines are in the pipeline, and they're likely to work better. So when I recommend to a dance studio that they compromise their artistic integrity by being safer this year, it's just temporary. You can get back to Pilabolus next year, I hope. So with that, I'd like Crystal to comment on a vital element of a dance studio's environment. One of the elements is the cleanliness of the studio in terms of the dance bar. I don't know if that's what it's called, but also the air quality.
Right, so two very important points. So first about disinfecting high-touch surfaces. So this will be important for elements like the dance bar, also for the floor space if that's being used for performance. And there are disinfectants that are being recommended by the EPA. The link's being shared in past webinars. I'd be more than happy to put that in the chat. Using these disinfectants between groups will be important and recommended for performers and also teachers to apply. With regard to the ventilation, these are typically spaces that people are spending extended periods of time. So we want to think about what is the air change rates within each one of these spaces. So how many times does the total volume of air within the room space change over? And how much fresh air or outdoor air is being incorporated within that mix, and how much of it is being recirculated. So there's been a lot of discussion about what is the ideal number of times to change over air within the space. There's been recommendations of about 3 times per hour to ideally 6 times per hour. And this is really something, a conversation to have with the building manager to see, is that feasible with the building's HVAC system that's in place. And then if it's not feasible, to think about supplemental controls. And I would be happy to direct people to the recordings available from the last session that we had where we discussed this in detail.
Great. Thank you so much. Thank you, Crystal. That's great. Along the lines of helping our performers a bit, Long Wharf, we have a question that came in from Long Wharf Theater. Actors Equity requires all performers be tested once a week with results back in 48 hours. Do we know of any companies that would come to our theater to test all of our folks and and then of course one of the questions would be how affordable is it? Do we have any idea what a cost to do such a thing would be? Sten, is that something you have any information?
You know, I was typing answers to questions and I completely blew off your question thinking it was for one of my colleagues. I'm sorry. So I'll
Stan,
stop
come
typing
on now.
answers to questions and I'll listen to you. Tell me again.
Well, right down the road from where you are, Long Wharf Theater really needs an answer on this one.
Okay, go ahead.
Actors Equity requires performers be tested once a week with results back in 48 hours. Do you know if there are any companies out there that would be willing to come to the theater to do such work, and then have any idea?
Yeah, we're in a bind with testing. I'm afraid we just don't have our act together in the United States with testing. I mean, you look at what Italy and Spain and China and South Korea, even Iran, what they've been able to do with their testing infrastructures, and we are not there yet. Now, Connecticut has gotten its act together better than most states, and the state labs, which you can find out very easily on the internet, some of them are drive-through and some of them are walk-through, but they are providing 48-hour turnarounds. We've got one in East Haven. One of my colleagues had a child return from Russia and got a test there and had the result in 48 hours. So the state is doing a good job. Why the private sector is not doing a better job? You know, we're hearing a lot about the huge diagnostic company Quest, and we're hearing about 3-day, 4-day turnarounds. I even hear the occasional horror story of more than a week. And of course, testing that you get a result back 4 days later, that's not the point of testing. You need a response quickly. It's something we can research whether the arts organizations of the state want to band together on testing. If you band together and you have a volume of testing, you may be able to broker a unique arrangement with one of the testing sources. Yale has forged an alliance with the Broad, spelled B-R-O-A-D. The Broad is a large research center in Cambridge. It's a collaborative entity between MIT and Harvard. And the Broad has made available excellent high-quality PCR testing. And when we sent our specimens to them a few days back, we got our results in 12 hours.
Wow.
And they are also doing this as a public service. They're not doing it they're not monetizing it. So they're trying to break even. So the tests were very affordable compared to now, nothing more affordable than free from the state, but they were very affordable compared to the private sector. So offline, Eric, you and I might want to research that. And it does take some organization because you need a vehicle that carries your specimens from Fairfield County, through Tolland County, wherever you are, and then spirits them off to Boston. But the cost of that might be quite modest if we had enough volume, and the savings from the Broad. And Broad is doing this for universities, and the question is, would they do it for the arts? And I wouldn't be surprised if we could talk them into it.
Great. We'll look into that. Thank you, Sten. Along the lines of information sharing, this goes back to the question about dancing, Sten. How should teachers who feel unsafe about or are uncomfortable about lack of protocols at a school or studio handle the situation? In other words, do you have any links or resources that they could share this type of information clearly to their employers?
So you're saying if I am a dance instructor or a theater director or a musician, and I'm concerned that my employer, permanent or temporary, is not savvy to these issues. How would I educate them? Is that the question?
Exactly. That's exactly the question.
Well, Crystal and I and Marie and a couple of our clever doctoral students and one of our building experts, HVAC experts, wrote a book chapter recently, and we tried to articulate what some of those issues might be, and we might be able to share that. But there is the governor's reopening Connecticut material. I can drop the web sites into the chat room for people to access that right now if you wish.
That would be super.
And so there unambiguously are resources that can increase the consciousness of owners and managers. Many of the owners and managers are on this phone call, making every effort to open their venues as safely as they possibly can. So in many respects, it's just a communication challenge, as Marie has been highlighting. It's the challenge of being able to pass on what exactly you're doing, and doing that in a crystal clear fashion so that your patrons and employees and clients and contractors and musicians and actors and all the rest are aware of what you're doing. So it may be that they'll be pleasantly surprised if you simply communicate that effectively. By the way, we've talked about the notion of a live event and having one of you or one of us on the stage for 3 minutes, reminding the audience of exactly what's being done to keep them safe and how you're asking for their cooperation to adhere to those safety precautions. I think if I were in the audience and of a show in the middle of the coronavirus pandemic, I would be appreciative of such an interruption, of such a preamble to the show, because it would reassure me.
Yeah, absolutely. Yeah. I think our dancer world has expressed an awful lot of desire for help. So just for all of you listening, you should be in contact with my office through the email office@Shoreline Arts Alliance. If you'd like to join us, we're going to do a couple of site visits at dance studios, one up in Eastern Connecticut at Eastern Connecticut Ballet and one in West Hartford coming up in the next couple of weeks. So we love to share with many folks of like questions at the same time. So we're happy to have you send somebody along on this visit. So contact us if you'd like to be a part of that. And we're also doing a site visit, I believe, on September 1st in Hartford. That is for a large performing arts facility. Arts Collective is where we'll be. So if you'd like to join us on one of those kinds of tours, we're happy to do that. Oh, and I guess I should also mention we'll be at Ivoryton Playhouse as well soon. So we're actually spending the next month, I'll say, doing a lot of site visits, which a couple of you may want to join us. We can't have a massive amount, but we'd like to have some of you come along. So that'd be great. Judy Dworin has another question for Sten. So Sten, let's stay off the Q&A for a little bit.
So my question, Sten, is should staff and teachers be empowered to remove students who are not listening to directions and they're not being compliant to the safety of everybody else in the room?
One of the least pleasant challenges is when we are asked to be policing other people's behavior. But I think in the arts, many of us are teachers of one sort or another, and we're used to this. We've had students act out, we've had colleagues act inappropriately, and we're used to giving constructive feedback, trying to improve comportment and compliance with reasonable requests. So we'll have to put our big boys and girls pants on and confront people. Now, you know, when I was a kid, in the 50s and 60s, the whole neighborhood was my parents. I mean, all the other parents, if I was out of line, they'd say something. But in the modern era, that's not so common anymore. And you see somebody misbehaving on the street, you won't necessarily approach them and say, you really shouldn't throw your garbage, or you really shouldn't bully this child. I mean, we have a tendency to sort of skulk away and not do that social. Well, now we've got to rediscover our social obligation, and we're going to have to remind people your mask, is something that has to be worn above the nose. It doesn't do you any good wearing it down here. We need your mask to be in place. Sir, your beard cannot be covered by the mask. I don't usually wear my beard this way, but I've trimmed it back so the entire beard is within the mask. That's the only way the mask will fit properly. There are all sorts of strategies. Would you mind using the hand hygiene? You see somebody conspicuously not using it when they should. So there's going to be a lot of feedback to our employees, to our customers. But I think when done without an edge to one's voice, when done in a friendly, supportive, nurturant way, I think people will get the message that you're just trying to keep them safe.
Yeah. So I can't believe this hour is already running away from us, and we've got so many questions coming in here that we'd like to answer. I'm gonna just try to jump ahead to ask a question about bringing in outside musicians, bands, artists. What should we be doing to ensure that our staff and audience are safe from these outside musicians, bands, and artists? Sten, do you have an answer for that one?
I was typing an answer to another question, Eric. I'm so sorry. I keep expecting you to leave me alone since I'm the long-winded one. And
yeah, I know. I actually probably should leave you alone.
Crystal, who are pithy and to the point.
Yeah.
Say it again.
Well, I'm just wondering if there's any additional information you could share, and I'll ask you to stay short with this question. How do we ensure that our staff and audience are safe when we have musicians who are coming from outside, or bands or artists coming from outside the community? What do we need to do? Anything additional to keep us
very, very challenging, very challenging. It's not a terrible thing to think about segregating your band. And if you've got some form of a green room or some form of a facility where they're going to be in their leisure time, to limit the access to that facility, and not have every one of your staff going in there. Have the staff going in there who are masked, who are going to stay physically distanced, who are going to pay attention to hand hygiene. Because if those individuals are from out of state or wherever it might be, they may be coming from a higher prevalence zone, and they may have an asymptomatic carrier. They may have somebody with sniffles and they think they've got a seasonal allergy, but in fact they've got incipient COVID. That's one of the big problems with COVID-19, is that the symptoms are so non-specific. The loss of sense of smell is a little more specific, but most of these symptoms are a lot like a cold or an allergy or early flu. So it's very hard to judge whether somebody's really got COVID, and a lot of people don't know they have it. So
we really want to keep them separate, is what you're saying.
Yeah, I think keeping them reasonably segregated, reasonably separate, not having them mingle.
Yeah.
If you want to do a signing of CDs, have some physical separation, have them wear a mask, have the clients wear a mask. I think we have to use the same, we can't have one principle for everybody and a different set of principles for our stars.
That's right.
Leo DiCaprio is going to have to wear a mask.
That's right. We want to make sure we get to assessing our consumer confidence. So Marie, I'm going to ask that we turn to you for a little bit. What are some ways that we can assess our consumers' confidence? And is there specific information we should be collecting to make those assessments?
Sure. Yeah, I think I mentioned this before, but just, thinking about who your primary audience or primary members, patrons, consumers are. Again, is it mostly older folks, younger folks, a mix? Is your audience mostly local people, or do you have people coming from other states routinely to your events, your organization? And, thinking about this can be a little bit harder to gauge, but, trying to think about how concerned consumers are, how much they're trying to adhere to prevention practices. And, you can look to local news, social media. That can kind of be helpful way to kind of gauge what people in your area, what your consumers might be thinking, how they might be feeling about this.
Great. John Carl, I know you have a couple of questions to ask.
Yeah, well, are there any apps that can be helpful?
Sure. There's, a few apps that kind of, it's going to be a really terrible pun, kind of almost take the temperature of areas where people are. There's one called How We Feel, which is one that I like, and it just collects information. It's something you put on your phone, and every day it kind of pings you and asks how you're feeling, not just physically, but also emotionally, mentally. And when you kind of answer, it's like a very short set of questions, like 3 questions or something. When you answer those questions, it then shows you how everybody else in your zip code is feeling. So that's kind of an interesting, unique one that I've seen that kind of incorporates both like the physical COVID stuff with the mental, emotional stress. There's some other apps, the Healthy Linked COVID-19 Tracker, the Coronavirus COVID Tracker. These are more specific. They basically just provide kind of a map of the hotspots where there are outbreaks. So it's really kind of more focused on physical health and COVID cases. But again, it kind of gives you a sense of how people are doing, how an area is doing. And, there is some data out there to suggest that when people know that there are more outbreaks and they're going through kind of a surge of cases in their area, they feel a lot less safe going out, a lot less confident going out. So those are some ways that you can kind of think about that and look at that.
Thank you. What about how to collect data? How would we collect data?
Sure. So, sending out surveys or kind of more qualitatively interviewing members. And you can send out surveys electronically. They're free survey websites that are pretty simple to use, and you can just send out a quick thing to people either before, when they've bought tickets before they come, or after they've been to your venue, to kind of see how things went and what worked well or not, and you can publicize some of the good feedback. And again, if you're working with marketing people, communications people, they're really great at helping to design these things.
Wow, thank you so much, Marie. So again, it's 11:01, and I'm so sorry we're pushing past the hour here. So much information and so many great questions coming in through all of our different venues, through Facebook and through Zoom. But Marie, before I wrap it up, is there anything else that you really wanted to get out on the table today? Because I think your information is so helpful to join in our team of helping our arts community and culture.
I think those are the main things. I think, just being transparent with both your staff, employees, but also your patrons and consumers. Really being transparent and educating people is going to be the most helpful thing we can do right now.
Great. Well, thank you. Well, everybody who joined us today, and those who are going to see it in the next few days through Facebook and YouTube. Again, we just thank you so much for your commitment to making sure we're looking through the lens of science to make all these difficult decisions as we move forward. Our consumers are really such the lifeblood of how all of us survive, and so making sure that we're finding ways to help them feel confident in coming back to our arts venues and our communities is vital. They all want us back, but we're doing this with prudence, and I so appreciate that. Sten, Crystal, Marie, wow, thank you again for all you're doing to help us return to work, as it were, or find ways that we can do so. Our next webinar is actually not scheduled till September 18th. Seeing all the questions that we've missed today, we may want to try to find one between now and then. However, I will say that we're going to be doing an awful lot of being out in the community and finding direct questions to then bring back to answer. So again, don't hesitate. Don't wait till the day before the webinar to send us information on questions, because all your effort in sending us what you need is what helps us determine what's next. We know that the artists community and arts teachers, we need to help you with a lot more information on specifics of how you can do your job and be safe. And so that's coming as well. Again, thank you all so very much. Thank you, Sten. Thank you, Marie, Crystal, and our wonderful task force. And I hope you guys have a great rest of the week, and we'll see you very soon.